Okay. Well, dear Chairman, Co-Chairman, and all the colleagues, it's very nice to be meeting you here in Philadelphia. Above all, please let me introduce myself. My name is Lishan Zhou, and I came from China, and I work in Wuhan Children's Hospital. Well, on behalf of my chief, Professor Suqi, and our team, Department of Integrated Traditional Chinese and Western Medical of Wuhan Children's Hospital, I thank the conference organizing committee to offer us this great platform to share our research. Okay, well, our research is preventative effect of massage on gastric volvulus in infants with gastroesophageal reflux-induced pneumonia. Oh, what's the matter?
So could you try the next slide? Yeah,
oh,
now it's okay.
It's
Yeah.
freezing. Okay. Which one? Okay. Now, I will doing the following two aspects to introduce to you. Well, part one, research background. Why we choose infant pneumonia to be our study subject. Pneumonia is one of the major reasons of death in those aged less than 5 years in developing countries. And for infants, especially suffer from pneumonia and can be severe. Here, Professor Zongqi Dong, who is a famous Chinese specialist in pediatric respiratory and also an honorable professor of our department. He found a difficulty in the treatment of infant pneumonia in his daily consultation of refractory disease. Well, the difficulty including 3 aspects, which are severe coughing and recurrent in short time, as well as refractory to antibiotic treatment. So he posed the question, what is the particularity of infant pneumonia? Is there any deep reason that we did not find yet? So, with that doubt, we did a retrospective study next. Our team collected medical records data of 792 infant inpatients of our hospital from 2008 to 2010 with an age of 1 to 4 months. Well, we found a high prevalence of 80%, 72% of gastric volvulus, also we can call it GV, in those infant patients. And nearly 2/3 of these GV patients complicated with gastroesophageal reflux, or GER. So after analysis, we sum up the characteristic of infant pneumonia complicated with GV and GER, just as Professor Dong already summarized. There are 3 points. Point 1, severe coughing, and mostly like spasmodic cough. Here we prepare a video for you. Oh, it cannot work. Oh, okay. Yeah, well, the cough without relief, even the imaging examination of lung shows improvement. Point 2, recurrent respiratory infections. And the incidence rate of recurrence is 14.46%. And point 3, refractory to antibiotic treatment. Well, besides these 3 points, we still notice that 64.71% infant pneumonia became deterioration during the course of the disease. So here comes the point 4, high probability of severe pneumonia. Well, based on the previous study, we get the conclusion. the complication of GV and GR may be responsible for the ineffective of antibiotic treatment in infant pneumonia. Therefore, the idea for further research is forming, that is, therapies designed to improve GV and GR when treating infant pneumonia. Now let's go to the key points, the part 2, research contents. To verify our idea, we carry out this research named Preventative Effect of Massage on Gastric Volvulus in Infants with Gastroesophageal Reflux-Induced Pneumonia. Firstly, methods. Well, study population. This is a 3-year study. 118 patients from our department, aged 1 to 6 months, were enrolled and diagnosed as GV with GR-induced infant pneumonia. Diagnostic criteria. Okay. First of all, I will give a brief illustration of criteria for infant pneumonia. Here, textbook of Pediatric 8th edition as a reference guide. Now, let's go for the core. The criteria of GV and GR. Well, before that, we would like to review GV together. Here. Gastric volvulus consists of a pathological rotation of the stomach around the axis. Well, it can occur on its longitudinal axis, named organal axial GV, and it can also occur on its transverse axis, named mesenteral axial GV. Well, stomach rotation about both axes is confirmed as combined volvulus. Here we have to say that a rotation of the stomach of more than 180 degrees always need surgical treatment. So only a rotation of less than 180 degrees and mostly result from laxity of the angering ligaments of the stomach were considered eligible for our study. So, for our study, radiography of the upper gastrointestinal tract, or UGT, using iodine-containing contrast had to reveal GV. Those belongs to any type of GV, and stomach rotation of less than 180 degrees were included from the participation. Now, let's talk about GR. Well, gastric esophageal reflux is a condition in which the stomach contents leak backwards from the stomach into the esophagus. Well, it's normal for infant having physical GR, but it's pathological GR if durative or frequent reflux exists. It should be noticed that for infant, when complicated with pneumonia, any reflux should be seen as pathological GR. So, just as GV, here, UGT also used to reveal GR by more than a 3-fold within 5 minutes, and an angle of his become obtuse. Yeah. The esophagus and the gastric fundus shape the angle of his. It's normally an acute angle. Well, besides that, 24 hours pH monitoring of the distal esophagus also were used to estimate the GER for some infant of our study. And the MISTER score is crucial for this examination. Well, the line of this score is 14.72. So meet or exceed that is positive. And the higher the score, the more severe the degree. Inclusion and exclusion criteria. Here, we want to explain the first line of exclusion criteria. Well, those patients who appear type 2 respiratory failure need mechanical ventilation, and asphyxics after CPR must transfer to ICU for further treatment were excluded. Grouping and general information. Okay, 180 eligible cases were divided into 4 groups. And here, BGT means basic treatment group, and MTG means massage treatment groupment. And here, the difference lies in the number 1 and 2, only about the application we used for the diagnosis of GER, just as we mentioned before. And the BTG 1 and 2 are control groups, and the MTG 1 and 2 are intervention groups. So, as shown in the table, all these 4 groups were same in baseline. Okay, interventions. In the basic treatment, we still take the textbook of pediatric as a reference guide for infant. Well, for GV and GR, there are 3 types for therapy. Well, the first one is pastoral, and in clinic, a 30-degree slope pastoral nursing shows in these 2 pictures. And the second one is dietary. The third one is pharmacologic, and including omeprazole and domperidone. Well, domperidone is the major one, and the omeprazole only administration to those infants who had severe acid reflux. Okay, in the basis of the basic treatment, massage added for GV for in our research for this massage treatment. Reference to the essence of traditional Chinese medicine of treatment. Our team originated this massage treatment. We named that 理气和中 massage therapy, comprising 4 steps. And the 4 steps are in this order. Step 1, push from the palmar crease to Ban. And step 2, push abdominal yin and yang. Step 3, poking of Tian Shu. And step 4, poke alternately bilateral Zhu San Li. From now on, I will focus on the instruction of our massage treatment in the following parts. Well, the first step, push from the palmar crease to Ban. The location of Ban is along the outer edge of the thenar palm. And just following the direction of this red arrow, this step applicate a rectilinear pushing manipulation, and 3 times in each time, and press to a depth of 0.2 to 0.3 centimeters. And the purpose of this step is to attenuate vomiting and cough, which are the major 2 symptoms of infant pneumonia complicated with GV and GR. So this is a principal point. Okay, step 2, push abdominal yin and yang. Well, following these 2 black arrows, this step applicate finger pushing massage from the center to the 2 sides. And the location changed with the type of GV. From Danzhong to both sides of hypochondria is for organized exhale type. Danzhong lies in the middle point of line between 2 nipples. And from Zhongwan to both sides of abdomen is for mesenteric exhale type. And Zhongwan lies in the middle point of the line from subxiphoid to umbilicus. Well, for combined rotation, we just choose the way of dominant type. Yeah. Well, this step we use 200 times in each time and press to a depth of 0.5 centimeters. And the purpose of this step is to promote digestion and the correction of stomach rotation. Okay, the next step, poking of Tian Shu. Well, the location of Tian Shu is 2 cuns beside umbilical region, and the cun is a measure unit of aquipoint location. Here, we use aquipoint located method by finger tune. Well, the width of patient's interphalangeal joint of the thumb as 1 tune. Yeah. Following the 2 white arrows, at this step, applicate poking manipulation and 100 times in each time and press to a depth of 0.5 centimeters. And the purpose of this step is to strengthen enterokinesia and improve flatus. Well, the last step, poke alternately bilateral 足三里. Well, 足三里 is a tonified aquipoint. Just compares to the 3 steps ahead. This step is a etiological treatment. As we mentioned before, laxity of the angling ligaments of stomach is one of the causes of GV. So poking 足三里 can improve this functional disorder by strengthening the body and promoting growth. And the location of 足三里 is 3 tuns below the lateral depression of patellar ligament and 1 tun beside the tibia crest. Here, we still use aquipoint located method by finger tun. Well, the width of patient's 4 fingers close together as 3 tun. Well, in this step, we still use poking manipulation just as step 3 and 100 times each time and press to a depth of 0.2 to 0.3 centimeters. Okay, finally, we exhibit the whole process of our 理气和中 massage therapy by videos. Okay, step 1. Push from palmar crease to 板门. Okay, step 2, push domino yin and yang for organal axial type. Step 2 for mesenteral axial type. Step 3, poking of 天枢. Yeah, step 4, poke alternately bilateral 足三里. Okay, so the massage treatment once a day and 15 minutes in each time and continued for 1 week had achieved the aim of strengthening the stomach to stop vomiting and regulating stomach to asthenia. Okay, observational index. Well, before and after treatment, symptoms, physical signs, and the laboratory studies were recorded. And we set a scoring method for symptoms and the physical signs. And the lower the score, the milder the degree. And after treatment, the evaluation of effects were also noticed. And the safety observation were included. Well, due to the time limits, I had to skip all this part of result. You could find that about the clinical effects, symptoms, and clinical examinations, and severe pneumonia, the details in our article. Okay, discussion. Well, the results of our study indicate that one, infant pneumonia closely related to GV with GER, and two, there have been few studies into infant pneumonia complicated by GV and GER. So pediatricians should pay more attention to that. Effective treatment of infant pneumonia complicated by GV and GR, reliant not only on standard anti-inflammatory treatments, but also closely related to the reduction of GV and GR. So three, we had introduced the TCM background of our traditional Chinese external treatment named Li Qi He Zhong massage treatment. And four, massage by timely correction of stomach rotation is effective in the treatment of GV with GR-induced pneumonia. And what is more, it can also reduce the reduction of severe pneumonia and pneumonia recurrence. Okay, conclusion. Concluding the discussion, we may say that massage treatment can prevent GV with GR-induced pneumonia in infants by timely correction of stomach rotation and the subsequent attenuation of GR. Well, presenting one case report at last. A 2-month-old female administered to our hospital because of coughing and dyspnea of 20-day duration that was refractory to anti-infection therapy for 14 days at a local hospital. Well, after a hospital admission, she undergo chest radiography at first. Here, showed pneumonia with emphysema. So please follow my light here to this red arrow. This shows the descending aorta is faint, means the position of the inflammatory is here. And we can see this blue arrow point a typical imaging of emphysema named intercostal sign. And this parallel ribs also means emphysema. Well, after that, she had undergo UGT. Shows GV with organelle axial type and GR. Well, follow me. Here, we can see the greater curvature turn upside and near the diaphragm. And the greater curvature is above the lesser curvature. So the whole stomach looks like a shrimp. And here, the red one means the abdomen esophagus extend and cross with the greater curvature. And here, the blue one means this. Duodenal down, hung upside down. So this whole images together tells us this one is organelle axial type GV. And for GR, we can see this this yellow irons shows the iodine reflex in esophagus. Okay, microbiological culture of sputum is negative, by the way, after 8 days of basic and massage treatment. She had undergone chest radiography again. Okay, now we can see here, oh, sorry. Like the yellow one point, the descending aorta is clear and no more typical imaging like the blue one, and the size of the ribs became normal. So means inflammatory focal absorbed and emphysema improvement. Well, she had undergone UGT again too. We can see here the great curvature turned back and no more iodine reflex in the esophagus. So it means a correction of stomach rotation and the GR improvement. She was discharged from our hospital and did not recurrent over 1 week period fellowship. So that's all. Thank you. And here is our Chinese word. 谢谢.
Excellent presentation. Very, we like the pictures and the very good presentation, description and the x-rays. Any questions from the audience? I have one. You know, many infants have reflux for few months.
Yeah.
You know, it takes up to 6 months and then they start getting better. You're doing your treatment only for 1 week.
Yes.
Do you think some of these infants may have reflux and other problem again?
Yes, we consider that, but sorry, I had to discuss that with my chief. Can I?
Sure,
Okay.
absolutely, yeah. That was interesting.
Well, she says that we use this 1 week fellowship just according to the guideline for infant pneumonia.
Okay.
If that happened after 1 week, we should consider that's another biotic, another infection.
Okay. Thank you very much. And please tell her we all loved it.